Retrograde amnesia is memory loss of events that occurred in the recent past before the onset of amnesia. Research shows that people who experience retrograde amnesia are more likely to lose memories closer to the occurrence of the amnesia. For example, if John was diagnosed with retrograde amnesia in the year 2013, he is more likely to lose memories from 2012 and 2011 than he is to lose memories from 1980. It is possible that he loses those memories too, but more likely that he loses memories closer to 2013. Luckily, those with retrograde amnesia can still form new memories. Symptoms of retrograde amnesia are false memories, confusion, or brain and coordination problems. These symptoms are similar to those associated with other types of amnesia. The only specific symptom of retrograde amnesia is forgetting past events, as opposed to new ones. For example, John might not recognize his wife of 5 years, and he may recall having 4 children, even if he has none. This can be difficult for loved ones. For example, in the movie The Notebook, the woman doesn't remember who her husband is. He tells and retells the story of her past, but she seems to forget again and again. Causes of retrograde amnesia include brain injuries, surgeries, traumatic events, nutrition issues, infections, or electroconvulsive therapy, commonly known as shock therapy. At times, it can be difficult to track the exact cause of one person's retrograde amnesia. For example, in soap operas, a serious head injury is the usual suspect for amnesia, which can be a cause in reality as well, but it is not the only possibility. Doctors will ask many questions in order to determine what the issue is. They'll ask about family history, drug use, including prescription and non-prescription, alcohol use, recent head injuries or surgeries, what the patient can remember or not remember, and any other symptoms. It's likely that the patient will undergo tests. They can be scans, reflex tests, or simple questions. Questions may include recent news or topics, such as the patient's address or name. While retrograde amnesia can occur even with precautions, appropriate measures can help. Safety precautions. Wearing a helmet or seatbelt, depending on the vehicle of choice, can prevent serious head injuries. Prompt medical attention. Treatment of any infections or serious head or brain-related injuries can prevent excessive damage. Treatment for retrograde amnesia focuses on the following options. Supplements. For those with nutritional issues, supplements may improve symptoms of amnesia. This can help, but may not resolve all memory problems. Medications. After careful analysis of the brain, doctors may recommend certain combinations of medicine for the patient. It's important to note that while medication may improve symptoms, it may not return the patient back to exactly what they were like before the onset of the amnesia. Technology. Keeping track of daily events via electronic calendars can help patients regain a sense of normalcy. Many people without amnesia use their phones or computers to remember all that they have to do that day, so it is a great option to help patients feel like they are part of the community. Occupational therapy. Professionals can help patients formulate strategies to remember new information. They can also help patients regain their normal schedules using these strategies. Discontinue use of non-prescription drugs and alcohol. This can decrease interactions with medications and also reduce any possible negative effects. While it's important not to cause stress for the patient, amnesia can be particularly difficult for family members and loved ones of the patients. In extreme cases, patients have a hard time remembering who their loved ones are. It's important to remember that there are counseling and therapy options for family members and loved ones as well. Support groups have also been proven to be helpful. Other than that, it can be beneficial to become educated about the type of amnesia the patient has. Retrograde amnesia is the loss of memory concerning events that occurred in the recent past, such as in the last several years. Patients with retrograde amnesia may retain longer-term memories, such as from decades ago, or they may lose those memories as well. Patients with retrograde amnesia can still form new memories, although they may develop false memories and experience confusion. They may also experience brain and coordination issues. Retrograde amnesia can be caused by brain injury as well as surgeries, infections, nutrition problems, traumatic events, and electroshock therapy. To diagnose amnesia, doctors will use a series of questions and tests. To treat retrograde amnesia, they may prescribe medications or dietary supplements, have the patient give up non-prescription drugs and alcohol, recommend using electronic calendars, or refer the patient to an occupational therapist. People can reduce the likelihood of developing retrograde amnesia by always wearing a seatbelt when in their car or a helmet when riding a motorcycle or bicycle, and by seeking prompt medical attention for any head injury or infection.